The physical impacts of this virus have been devastating. I myself have held the hand of dying patients who are crying out for their family that they can't see. I've taken care of coworkers as they fight for their lives on a ventilator, and knowing that they got sick because of the hospital or their government hasn't protected them. Throughout this pandemic, we've had to reuse N95s so many times. Sometimes the masks literally fall off our faces. President-elect Biden, there is something seriously wrong when nurses have to take to the streets to beg for protection in the middle of a pandemic. What we're experiencing in Minnesota is what nurses are experiencing all over the country. We're not being given the protection that we need. We need to have optimal PPE for all staff to prevent airborne and droplet transmissions. We need testing of our workers and patients and contact tracing and notification of exposure for healthcare workers. Do you know that I have not been tested yet, and I have been on the front lines in the ICU since February?
You're kidding me.
No. Nurses across the country were so relieved and grateful, Mr. President-elect, when you committed to taking action that we need to have to get this pandemic under control. Thank you for committing to invoke the Defense Production Act, to increase manufacturing and distribution of PPE, which we need to establish, and also for establishing an OSHA emergency temporary standard on infectious diseases, which could enforce protections we need from our employers. Thank you for that. We are also grateful that you have committed to a robust and comprehensive pandemic stimulus plan to make sure that our patients have the economic support they need. You know, we nurses, we know that we are facing immense death and suffering in the coming weeks, and we will be there. But we need to act now. We need to act quickly to protect our healthcare workers so that we can save as many lives as possible. Thank you.
Mary,
I'm sorry, I'm so emotional.
No.
It's just...
You got me emotional. Look, you know, anyone who spent significant time in ICU like I did for months, you know what I used to do? After I got out, I observed, this is not COVID, but I observed the incredible mental strain on nurses in ICU units. And you know what I did for a long time after I got out? I used to drive back and forth to Wilmington, Delaware. I commuted every day. And but as vice president, what I would do, I would also, I would go out, back out to Walter Reed on the night shift and bring dinner and food for the nurses and hang out with them. For
the night shift? Cool.
The night shift.
That's cool.
And well, you know, one of the things that one of my neurosurgeons said to me was, you only see people walk out of the ICU either they're walking out and they don't ever want to come back because they don't want the memory, or they're carried out and they can't come back. And the psychic remuneration for you guys is missing. You don't see the people you save come back. And
right.
So I'm sorry for me to get personal about it, but there's a lot that I want to talk with you about. And but I excuse, as we used to say in the Senate, excuse the point of personal privilege here. But thank you for what you do and all your colleagues.
First things first, this is why having a president capable of empathy is important. And I don't mean that as a platitude. I mean that in the sense that it is critical to have a president who is physically capable of experiencing empathy so that the person who will be in charge of leading the pandemic response is able to actually care about the human beings whose lives are impacted by that very pandemic. So to hear Joe Biden satisfy what should be this bare minimum requirement is a 1,000-pound weight off the backs of so many Americans who've watched as Donald Trump managed this pandemic with zero regard for who lived and who died. And for people like myself who have family members that are healthcare workers, that stress is unbearable. So yes, empathy matters. Consider the alternative. With Donald Trump leading this pandemic and with 1,000 people dying a day, what did he do? He lied. He downplayed it. He said it would go away with the heat, that it was contained, that cases were going down to zero, that it would miraculously disappear. He told people to go back to work and kids to go back to school. He demanded stadiums open and people pack into campaign rallies. He fomented protests against stay-at-home orders. He politicized masks. Every step that was taken to protect people, he fought against. And as a result, we've lost more than 250,000 Americans. This is the 4th biggest mass casualty event in American history. So when I say that it's important to have a president who actually gives a crap about human life, this is why. The simple fact is that Donald Trump never wanted to do any of the work necessary to get this virus under control. This was always about doing the bare minimum and then launching his PR campaign to celebrate himself as if the pandemic was solved. He enacted a half-baked travel ban in January and then coasted off that for the better part of a year. Even though 40,000 people still entered the country anyway, leagues of other countries had enacted travel bans before us, and most importantly, it did not work. So it's pretty ridiculous to throw yourself a parade for solving something when nothing was actually solved. But Trump didn't care about reality, he was only interested in marketing it like a win. That's why, even as the death toll skyrocketed and cases surged, he was still holding press briefings where he'd publicly rate his performance a 10 out of 10. Again, the 4th biggest mass casualty event in American history, and by his own admission, Trump thinks he did a perfect job. So at this point, Trump's legacy with regard to coronavirus has already been cemented. The only thing to do now is convince enough people to take the same common sense precautions that scientists and public health experts have been preaching since the beginning. To wear masks, to practice social distancing, to limit public gatherings, and to stay at home when possible. I know that Republicans think that these steps are some socialist, communist, Marxist infringement upon your freedoms, but you know what else tends to infringe on your freedoms? Dying. So as of January 20th, Joe Biden will take office and finally get to work doing so much of what should have been done months ago. He'll call on state leaders, from governors down to council members, to implement mask mandates across the board, because they are the #1 tool we have to protect ourselves and those around us. Aside from masks, he'll call for nationwide testing and contact tracing, as well as a public health jobs corps comprised of 100,000 Americans to lead that effort. He'll provide free testing, treatment, and vaccines, and the vaccine will be based on science. And finally, he'll outline clear steps for schools and businesses to reopen, with a focus on ventilation, PPE, and restart packages to help businesses rehire workers and buy protective equipment. It's a plan that focuses on people and science as opposed to a re-election effort, which I can assure you will be a welcome change. And given what we're seeing in this country right now, that day can't come soon enough. If you like this video, please check out my podcast, No Lie with Brian Tyler Cohen, where I take a deep dive into the week's most important stories and interview major players in politics, including Kamala Harris, Katie Porter, Adam Schiff, Nancy Pelosi, Eric Swalwell, Mary Trump, Al Franken, Cory Booker, and many, many more. Again, that's No Lie with Brian Tyler Cohen, available anywhere you listen to podcasts.